Hi guys, and welcome to another video. This one's going to be a little different than my other videos. We're going to get serious and talk about my cancer journey. This video has been prompted by a recent conversation that I have had with another cancer patient that has the same type of cancer that I do, and it was very obvious that unfortunately she did not receive the best treatment that is out there for this type, and that she didn't even know, what the best treatment was. It's just kind of sad, and so I want to talk about my cancer, my journey specifically, and hope to educate other people out there a little bit about this cancer. No, I'm not a doctor, I'm a patient, but I am a medical social worker, and one part of my job professionally is helping link people with the resources that they need to make sure that they can receive the best treatment, to make sure that their insurance is going to pay for it, and just to make sure that they have what they need and help them navigate the medical system, which can be pretty tricky. And that was very highly illuminated to myself personally when I became the patient, and I needed help linking myself to what was available and making sure that I got the right treatment. And it's hard. It's hard when the doctors don't even know, and that's kind of what I want to talk about right now. So, adenoid cystic carcinoma is the type of cancer that I have. It's a head and neck cancer, but it's a rare type of cancer, and it does not respond to the typical treatments that other cancers do. So regular radiation doesn't affect it. Chemo doesn't affect it. Surgery is the best option to remove it, but you don't normally get it all removed by surgery because of the way it spreads and grows. It does not spread by the blood. It's not detected by any blood marker test. It does not spread along the lymph nodes. It spreads along the nerve endings and can jump from one part of the body to another, which is why they're never going to say that I'm in remission. The best that they will say is that there is no evidence of disease, NED, which is where I'm at right now. But they also say that it's not if it shows back up again, but when. It is a very insidious type of cancer. Once it's in there, it's really hard to get out. I was having symptoms and issues for several years before I was diagnosed. Now, the specialists that I ended up going to, who work with ACC, adenoid cystic carcinoma patients, say that my story is unfortunately very typical of what they hear from other patients with this same type of cancer. Let me make this clear. Most doctors have never heard of it, have never encountered it, and that goes for not only regular doctors, but cancer doctors as well. It's not something that is encountered very often, so they don't know how to detect it. They don't know what they're looking at when they're staring right at it on MRIs, and they don't know how to treat it. So my personal journey with leading up to diagnosis, first was experiencing a lot of fatigue and a lot of generalized pain throughout my body. When I first started going to doctors and complaining of my symptoms, they blew it off. They kept saying things like, oh, well, you're getting older. I was in my younger 30s at that point, and I experienced such a change in the way I felt. I was fine, I was active, I was healthy, I was skinny, I was pretty. All of a sudden I was gaining weight and I couldn't keep it off. I was in pain like crazy. Movement hurt, everything hurt throughout my whole body. I was so tired, I couldn't get enough rest, I couldn't stay awake and alert throughout the day. Yes, things like that happen as you get older, but it's not an overnight change, and it's usually not happening in your early 30s. My doctors were dismissing my symptoms and trying to placate me and trying to tell me that what I was experiencing was normal, and it wasn't. So my first piece of advice is, you know your body better than anyone else does. You don't have to have medical training to know that something is wrong. So keep seeking opinions. Go to more doctors if you need to, until someone takes you seriously and will actually look into what's going on with you. But it doesn't stop there, and I'll get to that. I was experiencing pain in my ear, pain and also a difficulty hearing. My hearing level is fine, but things sound distorted to me, and my ear always is painful, and there's sharp pains and also kind of more dull, achy pains. And like I said, the hearing is distorted in this ear, and sounds pierce this ear in a way that is very painful, especially loud and shrill sounds. And this whole side of my face, from like my ear, my jaw, everything on this side of my face is painful. So a lot of other symptoms I was experiencing as well. Vision in this eye would sometimes go out, like it would start going dim and gray, and sometimes it would stay that way. Sometimes I couldn't see at all out of this eye. One time it happened where it affected both eyes, but it was generally this one. This whole side of my face was experiencing issues. A lot of headaches as well. I've always had migraines, so I was kind of dismissing the headaches, but they increased in frequency. Not necessarily in intensity, but all the other pain that I was experiencing and the weird things going on with my vision. I was experiencing a lot of neurological issues, even affecting the way I was walking and like my coordination, my balance. So I ended up being referred by my eye doctor when my vision tests were getting kind of weird. My eye doctor referred me to a ophthalmologist neurologist. So she's a neurologist that specialized with eye issues. That's who I went to first, and she did like all the best tests and workups, complete testing of everything. I had MRIs, I had nerve conduction studies, I had everything that a neurologist would do, I had. Now, multiple sclerosis was, that's a diagnosis that there's no test for it. They come to the diagnosis by ruling other things out. So that was kind of on the table if they ruled out everything else that they could test for. A condition where there's like water and fluid on the brain. Right now I can't think of the name of it, but I probably will later, and if I do, I will put it on the screen. I was tested for that. Anyway, the neurology workups couldn't find anything wrong, and when I kept complaining of various issues and pain and symptoms, I began to get the feeling from the neurologist that she thought that I was, I don't know, drug seeking or making it up, because what I was complaining of, just nothing was registering on any of the tests. They saw a few cysts in my brain, which turned out to be nothing. I guess that was just an incidental finding. They found some cysts in my lungs, which again turned out to be an incidental finding. It wasn't cancer. I went to a pulmonologist. The neurologist ended up sending me to, I can't remember the specialist, but it was somebody who diagnosed me with fibromyalgia, which is a controversial type of diagnosis that some people don't believe really exists, others do. The medical community is split on it. There is no test for it. They say you have fibromyalgia when you're complaining of pain that they can find no other explanation for, basically. So it ends up being kind of a catch-all diagnosis when there's no explanation for what you're experiencing. Rheumatologist, that's who I was sent to. And so he just dismissed any of my concerns, didn't run any tests or anything. And so then I asked for a second opinion. I went to a different rheumatologist that did all the proper blood work, tested my ANA levels, looked for like autoimmune diseases like lupus, ended up diagnosing me with mixed connective tissue disease because I did have an elevated ANA with a speckled pattern, and that is indicating that there's something autoimmune going on with my body. My inflammation levels were high, and so I got put on medicine to treat an autoimmune disorder. And then my condition seemed to get worse from there. I think, I don't know for sure, but one of the treatment for autoimmune disorder is immunosuppressant therapy, because your body is attacking itself. Like your immune system is attacking your body, thinking that it's something like, an infection that needs to be fought off when it's not. And so they want to lower your immune system so that it won't attack itself. Well, that's when my pain and symptoms got so much worse. I went to the ER for pain. I ended up in the hospital with diverticulitis. I'm thinking that the immune suppressants had probably allowed the cancer to grow faster at that point. And at one point when I was in the hospital with diverticulitis, the doctor that was treating me there actually put in her notes about me, that I was just apparently making up symptoms. And she was very rude to me. I was answering her honestly when she would ask me what my pain levels was, how I was feeling. I would tell her, and it didn't add up to, she's like, well, your stomach, you're here for your stomach, how's it feeling? And, I was in pain everywhere. I was in pain in my head, and I kept telling her, I hurt right here, everything hurts. And she didn't want to hear it. She was just focusing on my stomach. And it was a very traumatizing experience to be discredited, to have my voice not heard by the people that I was going to for help, the people that I trusted to do their job and find out what was wrong with me, when they were writing it off as I was just looking for attention or just looking for drugs. I can't even take narcotic medication. I have a bad reaction to it. And so no, I don't want it. They've had to find medicines that work on me, because I have had to have some with the surgeries and everything, but that's kind of another story. No, I wasn't looking for medicine. I was looking to answers for what was wrong with me. So I ended up, finally, what happened was it grew into the roof of my mouth. On the hard palate of my mouth, there was a knot that was visible, and it had blood vessels leading to it. And so finally, my ENT that I had been going to complaining of pain, before that, he did a sinus surgery on me, a balloon nasal surgery, and I ended up hurting so bad from that. And he said, well, that's weird, because normally people feel a lot better after that surgery. He had never had someone come back after the surgery and say that they were in more pain than before. Nothing was adding up to him either, but he wasn't dismissive of me like the other ones were. He seemed to understand that maybe there was something that we were missing, rather than just immediately writing me off as someone who was making something up or drug thinking. So I respect him for that. I wish he could have found it sooner than he did. It had to visibly be present in my mouth where they could see something with the naked eye and say, that's not normal, let's biopsy it. So I went back and had another surgery with him, because he had already done the nasal surgery. and so that he put me under and did a biopsy of it. It came back positive for cancer. I had my PET scan. They figured out the type of cancer, adenoid cystic carcinoma. He referred me to, I live in Mississippi, and Jackson, Mississippi has University Medical Center, and so he referred me there, and I was seen by 2 doctors there, 2 surgeons. One of them I credit for being the person who basically saved my life. She knew enough about adenoid cystic carcinoma to refer me to Seattle, the University of Washington, which is the only place in the U.S., I think. There used to be more, but I think they closed down. Anyway, it's the best place, and I think the only place that has neutron beam radiation, which is the only thing that will touch this cancer. So if you are an adenoid cystic carcinoma patient, and you are offered any other type of treatment other than the neutron beam radiation, then ask about neutron beam, because you are not being offered the best treatment possible for your type of cancer. So anyway, I went to Seattle, which was very hard on me and my family financially, and just due to the fact that I had to be so far away from home for so long. I am so thankful to the doctor here in Mississippi that knew enough about ACC to know that the treatment that they could offer here wasn't going to be adequate. She knew enough about it to know what type of treatment it needed to be successful, which is the neutron beam radiation. And so she referred me to Dr. Larimore at the University of Washington, which he is pretty much the top expert, at least in the U.S., as far as ACC treatment goes. There, I think, is a place in Germany that also offers neutron beam, and there might be a place in one other country. And there are other places that are doing research into treatment options. They are doing trials. MD Anderson, I think, has a proton radiation option, which is still better than like the regular radiation that most people with cancer get, but it's still not the top-notch treatment option. Trials have been conducted, including chemotherapy in the treatment and immunotherapy, different options, and none of it has proven as successful as the proton radiation. Although I think with some of the immunotherapy, they are seeing some results. And so, like, if my cancer comes back, with the neutron radiation, it's so much more powerful than regular radiation. You cannot have it again in the same area where you've already had it before. So, like, if my cancer comes back in another part of my body, I can have the neutron radiation again. But if it occurs in the place where I already had the radiation, I can't have it again. So I would be, there would pretty much be no options for me at that point, except to try some of the trials and some of the other treatments that they are still testing, such as the immunotherapy and some chemo combinations. You know, it would be a Hail Mary at that point, but, you know, I still wouldn't be giving up just yet until I tried literally everything that was out there. And, you know, if they still said that, you know, none of this is working, the cancer is still growing, there's nothing we can do, at that point I think I would prefer a quality of life for what time I had left rather than being sick from all the treatment at that point. But, you know, you're not there yet. I'm not there yet. This girl that prompted me to do this video, because I heard her story and I was so heartbroken for her, because she didn't know that she wasn't getting the right treatment. I mean, her cancer was, I think, only at stage 2. Mine was stage 4. And I don't think hers would be coming back right now if she had gotten the neutron radiation. She got the regular radiation and was told that that should kill off any of the cancer that was left after her surgery. And yes, it would have if she had gotten the right kind. But unfortunately, doctors don't know how to treat ACC. So I went to Seattle. I left there in February and came back mid-April, so it felt like I lived there actually. And, throughout this whole process, the way doctors have treated me, the way I've been dismissed, the way they've just assumed that I was making things up or looking for drugs, it was very demoralizing. It's very demoralizing when you know that something's wrong, when you know that you're not drug seeking, and people just dismiss you like that. It was really hard to stay positive. It was really hard to trust in the medical community. It really shattered a lot of my trust that I had in the medical community. I always thought that the people that got diagnosed at stage 4 were the people who didn't take care of their health, or maybe didn't have insurance or couldn't afford to go to the doctor, or just for whatever reason ignored symptoms, because people will do that because they're afraid to find out what's going on. I never thought that someone who is as proactive as I have been, take charge. I've been seeking opinions and second opinions, and I've been getting all the best workups, and they were staring right at it and didn't know what they were looking at. It's just a rare cancer that doesn't present like other types. And I was victimized by the medical community because of their lack of knowledge, basically. It was like, I felt like they were somehow blaming me and being annoyed that I kept coming to them for help, when in fact there was something wrong. And it was just their lack of competency that put my life in danger, and I didn't get diagnosed early enough. It's been a very hard road. I'm still on a feeding tube. I still wear an obturator. I'll make another video about, I've mentioned my obturator in a lot of my videos, but I am planning on making a dedicated video about the hole in my mouth and the obturator that I wear. I'm just about to go in for another surgery to do reconstruction so that hopefully I don't have to wear the obturator. This would be the 3rd attempt at reconstructing that area, so I'm not 100% positive that it's going to work, but I'm willing to try it again. It's been really hard, physically, emotionally, mentally. I'm trying not to cry. 2 years ago, I didn't know how much time I had left, and the next year, when the 1-year anniversary came around, because I was diagnosed, I think, in November, and I had the surgery the day after Christmas. And I had no way of knowing at that time if that was going to be my last Christmas with my family. And so the next year, when Christmas came around again, it was such an emotional time because I was so thankful that I was still here. I'm drooling. I don't have feeling on this side of my mouth, so I don't know when drool or food or whatever is coming out of my mouth. I can't feel it. And out of my nose sometimes. But I was very thankful to still be here, of course. I mean, I've got 3 children and I've got 2 nephews. One has now left. Well, I've got more nephews than that. What I meant to say was in my household. So at the time of my diagnosis, I had 5 children in the house. Well, my oldest had already gone to college, but it was his first year in college. And all I could think was I might not even be here for my daughter graduating from high school. And I have a 14-year-old, he was 12 at the time. And I said, what are the chances that I'm still going to be here when he graduates high school? And just getting him out of high school, your job as a parent is not done. I was heartbroken over the thought that I wouldn't be here for their marriages and the birth of their children. I've always joked with my daughter that she was like the hardest baby, and like if she has a child like herself, you know, like how she was when she was a baby, she's gonna need me. She's gonna need my help. I want to be there for my family. I want to know my grandchildren when they come into this world. I want them to grow up knowing their grandmother. I want to be there for my children when they go through the hard times in life, when their relationships are falling apart, when they need to come home because they need their mom, because they need help through a rough patch. I don't want them to have to go through those life challenges on their own. I've always planned in my mind that I was going to be there to help them through those things, and we all do, you know, as parents. I know that we all do. But that's what was going through my mind, that I wouldn't be here for any of those things, and that is still very much a real concern of mine. I might not be here to ever get to know grandchildren or to see my children grow into the adults that they're going to be. And that's heartbreaking, but that is the reality of cancer. Now, I don't even have any makeup with me, that I can't even touch up my face now. I wouldn't have made this video right now if I knew I was going to cry. I should have known better. But I very much still to this day, and I'm only 2 years out from my diagnosis and treatment, so I still have a long way to go. But I still to this day have a hard time, like, when it comes to going to doctors, not just my cancer doctors or anything, but just going for regular health checkups or I'm not even wearing glasses right now because I haven't been to my eye doctor in like 4 years. Side effects of radiation is that it has completely ruined my teeth, and I think I'm going to lose my teeth because the radiation has killed them. But I find it very hard to even get myself to the dentist. It's just that the panic and the anxiety sets in over how I might be treated by the medical profession because of how they have treated me in the past leading up to my diagnosis. And especially when it comes to anything that I might need pain medicine for, because, you know, there's such a crackdown in the U.S. right now on the overuse of opioids, and they've changed the ways, the laws when it comes to prescribing, and like Xanax, which is something that I have been prescribed for my anxiety, and it's not as easy to get the medicines that I need now. I don't need any more pain medicine. Well, let me back that up. The pain that I was experiencing before I was diagnosed is still there, just the same as it was before. Because the nerves are affected, I will probably, I don't know how long or if that will ever go away, the pain from the nerves in my face. I am in a lot of pain on a daily basis. Not just here, but throughout my whole body. And no, I don't take anything for the pain. I cannot take any SSRIs, that's antidepressant medicines, and some of them are prescribed for pain relief for people that have diagnosis of like neuropathies and fibromyalgia, but I can't take them. I have a severe reaction to them, and so those are off the table. I have a severe reaction to most narcotics. There's 2 that I can take. Dilaudid is one of them, and that's something that you're usually given when you're in the hospital, but it's not something that they like to write prescriptions for you to take home. And so whenever I have anything done that requires the need for a prescription to be filled for pain medicine for me to take at home, they won't give it to me, so I end up having to just suffer through the pain with no pain relief at all, which is not fair. I think that they still somehow think that maybe I'm making it up, that, you know, I have these reactions to these other medicines. I can't take them. And so doctors don't like it when you say, no, I don't want that one, I want this one. They don't like that because they are so used to people who are drug seeking that they just immediately put you in that category, and they shut down and won't listen to what you have to say. And that happens to me all the time, and I feel like I am treated unfairly by the medical community, and therefore am denied some of the treatment that I need sometimes, definitely denied the pain relief that I need after a procedure or something like that, because they don't want to believe me. And it just that leads to a lot of anxiety when it comes to going to the doctor, period, for anything. So I have a lot of work to do, like emotionally and mentally, to come to terms with, this is my life now, and it's never going to end. I will be a cancer patient until the day I die, and I don't know if that day is going to be when I'm in my 80s or 90s, or if it's going to, like, I'm 41 right now, I'll be 42 soon, probably by the time this video goes up. So, I'm in my early 40s. I don't know if I'll ever see 50. And yeah, anyone can say that, because anyone can die in a car crash or drop dead from a heart attack. But for me, it's a lot more of a reality, because I know that this cancer at some point is going to come back and kill me. And there's nothing that I can do about that, except for continue to try to advocate for myself, which is what I've had to do through this whole process. So the one doctor that I saw, or the one surgeon that knew enough to send me to Seattle, is not the one that I'm following up with. And to be honest, the one that I am following with, I didn't like her at first, and she wasn't really listening to me at first either. She obviously doesn't know as much about adenoid cystic carcinoma as the other doctor. But the reason I follow up with her is because she's the one that did the repair work. Like, the first one took out the tumor, and then this one did the repair work, and she's the one that I continue to see, and she's the one I'm about to have surgery with to try to repair it once again, because it didn't take the first 2 times. And so anyway, I don't know that I mentioned that I'm a medical social worker, and yes, I am back to work full time. But as a professional, I help people all the time, advocating for their rights as a patient, helping them find and access the best treatment for themselves. And it's something that I've seen patients struggle with through, over the years, and they do struggle with it a lot. It's not easy to navigate the health system, especially when you're poor, especially for the ones that don't have insurance. But even if you're not poor, even if you're very smart, you have good insurance, when you end up with something chronic, something like what I've got, it's still difficult to navigate. And not just the health system, but trying to make sure you get the right benefits, trying to get on disability, trying to qualify for like Medicaid, and things like that are difficult. And I found out firsthand just how difficult it is when I became the patient, because that's what I do professionally. You would think that when it came to my own treatment, my own journey, you would think that it would have been a little easier for me, because I know what to do. It's what I do for a living. But it was surprisingly very difficult, and I don't know if that's because the cancer that I have is such a rare type that no one knows about it, or just what it is. But at first my insurance didn't want to pay for the treatment, because in their mind they were like, okay, well, there's cancer centers here, why do you need to go there? So I had to provide a lot of documentation. Doctors had to provide documentation. There was a lot of back and forth with my insurance company before they understood that any other treatment was subpar, that if I wanted a chance to live, to survive this, the neutron beam radiation that is offered only in Seattle is what I needed. And so I had to really push for that. I had to really advocate for myself to get my insurance to approve that treatment. And the fact that I knew that that was the treatment that I needed apparently already put me a head above some of the other patients who didn't even know that that was, the best treatment for this cancer. I knew that that's what I needed, and I still had a hard time getting it. And so then, I mean, I live nowhere near Seattle. I'm in Mississippi. I mean, Mississippi's here, and Seattle is up here. And it was, I'm not rich at all. Like, I can't afford to pay off work. It worries me if it comes back and if I need to go back up there for treatment again. Like, I can't afford that. I've already had to do bankruptcy to avoid my family becoming homeless because I wasn't drawing in any money when I was undergoing treatment. I had to pay for a hotel for like the 2.5 months I was up there. You know, living expenses. My family still needed to eat. They still needed a roof over their head. It was a very difficult time financially. Now, I don't think we can survive that financially again if we have to do that again, because financially we took such a hit to go through that the first time. I have been able to return back to work, and that's good because we cannot survive without my income. With this cancer, you're supposed to receive MRIs every 3 months, and so when I came back home and went back to my doctor, who I am now following with, she was telling me things like, this is what we're going to do, and it wasn't adding up with what the doctors in Seattle had told me. And I'm trusting them because they are the experts who treat this type of cancer. They know the most about it. I am definitely going to trust what they have to say over what any of the other doctors have to say, because these other doctors are not experts in this type of cancer. They might be experts in other types or in normal head and neck cancers, but not this type specifically. And the way other head and neck cancers are treated, it is not going to work for this type. It's a whole different ballgame. And so when she would say something like, oh, we're going to follow up with another MRI in 6 months, I'm like, well, that's not what they told me. And it got to her. She's like, who is this they that you keep referring to? And I'm like, the specialist that y'all sent me to, that I went to for the neutron beam radiation in Seattle, those are the they that I'm referring to. And those are the ones that told me what to be expecting as follow-up, and I want to follow their treatment plan, their recommendations, because they're the experts who treat this type of cancer on a regular basis, almost exclusively. So I trust their judgment on how often I should receive MRIs and, you know, what comes next and everything. And that wasn't the only thing that she would say that didn't add up to what they had told me. And so I think that she looked into it more, maybe contacted them. Every scan that I have, all of my records here are also being sent to Seattle. They are still following my care, even though I'm not physically there with them. They are getting all of my reports, and so they've been in contact, and my doctor is a little more on board now with following their recommendations and their treatment plan. But I am so thankful that they are there and willing and able to offer support and guidance to the doctors who are treating me here where I live, because I can't afford to travel up there every time I need a doctor's appointment or another MRI. I mean, that is stuff that can be done here, but just having it done still doesn't mean that you get the best treatment. I feel comforted by the fact that I do have the best treatment team following, you know, all of my scans and everything, because we're sending them up there. But, you know, even through all of that, with the doctor who is treating me here, I have continued to have to advocate for myself and to say, no, what you're saying really actually is not 100% true, and here's why. And I just urge every patient to learn to speak up for themselves. You can seek a second opinion. You can do research yourself. You can bring that research to your doctor and say, what do you think about this? And this is what it says we should be doing, or this is the treatment that research is showing is the best. Present that to your doctor. Educate yourself so that you know when what they're saying isn't really adding up to what your understanding of the best treatment is. And if you have a good doctor, they will recognize that, recognize their own limitations, and be willing to consult with someone who is more knowledgeable on the subject and listen to their recommendations as far as your treatment plan goes. And if they're not willing to or able to do that, get another opinion, find a doctor that will. Not everyone has access to the best treatment out there, but if you educate yourself and you bring your own research and education and knowledge to your doctor and discuss it with them, then you're both better informed and you're going to see the best outcome. Don't be afraid to stand up to them if you need to. Do it in a polite and respectful way. No one likes someone that's just constantly going to be treating them as if they don't know what they're talking about. You know, there's a way to do it in a respectful manner that still gets you what you need. I hope that makes sense. So this video has been long enough already. I'm going to let y'all go now. And if y'all want to hear more about my health, please make sure that you are subscribed. Turn on the notification bell. I will be doing a video about the hole in my mouth and the obturator and everything, and also vlogging through my upcoming surgery. So stay tuned for that, and thanks for watching. I'll see y'all later.